Hello everyone, good morning, good afternoon, good evening, depending on the time you're coming across the video. So this is Lydia with you again. Yes, your favorite nurse. Today I'm here to talk about prematurity. So I'm very excited to share this with you because have been privileged to work in the neonatal ICU, which we abbreviate as NICU, NICU, Neonatal Intensive Care Unit, for the past 7 years in my nursing practice, and it's a privilege. So annually, the World Health Organization celebrates the World Prematurity Day every 17th of November yearly. So that of this year also took place, but my schedules have been so occupying. I couldn't do something significant on that very day. So now, unfortunately, I'm opportune to do that, and I just want to share some insights. So please watch through the end and you will have one or two things to learn. And if there's anything you think I've missed, it will be interesting for you to drop it in the comment section. Yes. So for 2025, the theme for the World Prematurity Day was "Give Preterm Babies a Strong Start for a Hopeful Future." Oh my God. Now, the highlight of World Prematurity Day, it's usually a global moment to raise awareness of the challenges and impacts of preterm birth. And then the spotlight is on the urgent need to improve care for babies born too soon, while providing practical and emotional support for their families. So, it's usually challenging for the mothers when the babies have to stay for long in the NICU, and sometimes they are visiting, the babies are still critical, they are on a lot of life support, a lot of IV infusion, some of them with chest tubes, yeah, a lot of machines. So it takes a toll on the parents, especially the mother, because every mother expects normally to nurse their babies by their side immediately after delivery. So if you haven't been appreciating God on this, it's something that you should. If you've had your kids, they didn't have to test the four walls of the NICU, you should be so grateful to God. So, before dwelling on prematurity, I feel it's better for us to have insight on what is opposite of prematurity, because that is where full time comes in. Yes. So, like when the pregnancy goes through successfully, and then I want us to have some insight on some basic pregnancy terms that we are still going to be mentioning in the course of discussion for prematurity discussion. A normal human pregnancy lasts about 40 weeks, and that is 280 days when you count it from the day of the last menstrual period. So how do we I just explained how it is calculated. You count it from the day of the last menstrual period. So it's usually lasting about 40 weeks, a normal human pregnancy, 40 weeks gestation. But by days, that is about 280 days. Now, let's understand trimester. You do hear when women say, I'm in first trimester, I'm in second trimester, is something we should have in sight. A trimester lasts over 3 months. So the first trimester is from the time of conception till about 12 weeks. Then the second trimester is from 13 weeks to 27 weeks. And the third trimester is from 28 weeks to 40 weeks. You understand now? So now, a baby is considered full term when born between 39 weeks and 40 weeks and 6 days gestation. I just put some of these things down so that we will be very clear about it. So if it's your first time of coming in contact with this kind of thing, you may have to watch the video again, and you may have to do more research to really have an insight, because no knowledge is a waste, especially for the intending odogus and the intending young girls. it will help you to prepare your mind in advance of what is expected of you whenever your wife takes in to become pregnant, or when you, the lady, becomes pregnant, you do more on your own part. So before we now talk about the prematurity in the concept of full term, there is what we call the early term, there is what we call the full term, there is what we call the late term, and then there is what we call the post term. Early term, when delivery occurs 37 weeks 0 days through 38 weeks 6 days. Now, full term is when delivery occurs 39 weeks 0 days through 40 weeks and 6 days. Late term, when delivery occurs 41 weeks 0 days through 41 weeks and 6 days. Post term, when delivery occurs 42 weeks 0 days and beyond. So now, let's dwell on prematurity. I hope we have insight now. So, prematurity classification is based on gestational age and birth weight. So, on that of the gestational age, we have late preterm. These are babies born between 34 weeks and 36 completed weeks of pregnancy. Then moderate preterm. These are babies born between 32 weeks and 42 weeks of pregnancy. Then very preterm. These are newborns born between 28 weeks and 32 weeks of gestational age. Then there is this last one, the micro preemie. Oh my God. This is a baby born extremely premature before 26 weeks gestation, and then the birth weight is about 700 to 800 grams. Please, when we are using grams here, if you are familiar with kilograms, just know that the conversion of grams to kilograms is dividing by 1000. Okay, so if I say micro preemies are those ones weighing 700 to 800 grams, that means about 0.7 to 0.8 kg. So due to the very small size and undeveloped organs of the premature babies, they require extensive medical care in a neonatal intensive care unit, and they have high risks of health complications compared to babies born closer to full term. So the second classification of prematurity is according to birth weight. So here we have the first category, extremely low birth weight, which are newborns born less than 1000 grams. 1000 grams is equivalent to 1 kg. So the second category, very low birth weight, these are newborns born with birth weight of about 1000 grams to 1499 grams, and then the kg equivalent is 1 kg to 1.499 kg. Then the third category is low birth weight. These are newborns with birth weight of 1.5 kg to 2.5 kg, and that in grams is 1500 grams to 2500 grams. So now you can see that the acceptable birth weight that is considered normal is 2500 grams and above. That is 2.5 kg. That healthy lifestyle during pregnancy, it entails a lot, and you are going to hear about it in the course of the discussion. So now, I personally advise people a lot of things, including avoidance of stress. Don't just eat anyhow, eat by knowledge. There are some nutrition that can trigger premature contraction. You should have insight on all of those things. So let's talk about some common causes of premature birth. Premature births can happen suddenly with no one cause. Sometimes providers have to induce labor for medical reasons, But women can also go into premature labor due to the following. 1. Chronic health conditions such as diabetes or heart disease. But in any of these cases, once it is known early during antenatal, your gynecologist can put you through on how to manage these conditions, you know. Then conditions like placenta abruptio, placenta previa. Back then in our midwifery, we learned these as obstetric emergencies. They are serious issues. That's why as the woman that is pregnant, you need to pay close attention to your system. You need to pay close attention to any sign that you are not pleasant with. Your obstetrician should be informed immediately. So then conditions like preeclampsia can also cause premature delivery. So you see that even monitoring your blood pressure is very important, your sugar level, it's also very, very important. Then expecting multiple delivery, like for people that are pregnant with twin, triplets or quadruplets, this can trigger premature delivery. Then we have problems with the uterus or cervix. There are cases of incompetent cervix, like a whole lot of it. I won't dwell so much on it, on some of these points, but I just mention so that we have insight. Issues like vaginal bleeding or infection during pregnancy can cause premature delivery. Then using substances like drugs and alcohol or smoking during pregnancy. When we did health series, we talked a lot on all the unhealthy lifestyles, all the unhealthy habits. These are things that should be avoided during pregnancy as well because they can lead to premature deliveries. So now one more thing is, what are signs that a baby is premature? Yeah, we have talked about the low birth weight. That is one of the signs. Difficulties in breathing, because you can understand. We listed the categories of prematurity. You understand? So it is expected that a baby should stay inside for 40 weeks to be fully developed. So where the pregnancy did not lead to term, there are chances that the organs were not fully developed. But don't get me wrong, throughout my 7 years of practice in NICU, it's not only premature babies that come to the NICU. There are times that maybe some full-term babies, some congenital anomalies or other conditions, but they had to be admitted in the NICU. But it's in most of these premature babies, they also have to receive NICU care because they had their skill, like I've mentioned earlier, supporting the lungs function with ventilator. Even all these things have complications when they stay in the NICU for long. Like use of ventilator for a long time can cause ventilator associated pneumonia, infection can also set in. And but the good thing is you weigh the advantage more than the disadvantage because there are cases that the babies are on inotropes. These are drugs that help the function of the hearts, and the good thing is that most of the babies survive. But sometimes it's also heartbreaking when it's the opposite way, especially where you were the bedside nurse that is doing the last office and handling the cups to the parents. Like it's so emotional. But let's ride on. So we were on signs that a baby is premature. Yeah, the low birth weight, the breathing difficulties. In these breathing difficulties in the NICU, there is what we call the invasive support, where the baby is intubated for the support of the lungs function. Then we have the non-invasive, like the use of CPAP, high flow nasal cannula, a whole lot of them, a whole lot of non-invasive support for the babies. But when depending on the blood gas, that is what, and then the whole presentation of the baby with the experts in the NICU, the right steps will be taken. Then I want to also remind us, the mothers, whenever you are pregnant, please take your health serious. If there are medications that are prescribed for you to take, please, it's very important, because you know that the routine NICU admissions, the normal admissions, there will be CBC, manual differential, reticulocytes, then bone profile, which is serum calcium, magnesium, phosphorus. The summary is that you have a lot of contribution to make on the outcome of your baby. Yes. So you see, some women feel lazy with taking their prenatal medications. It is not right, because like I will explain here, there is some of the routine admission investigations for newborn. We have the CBC, which is complete blood count, manual differential reticulocytes, then bone profile, which is serum calcium, serum magnesium, serum phosphorus, serum glucose. Then the blood culture will be done, the blood gas will be done. Then we also test for MRSA using the nasal swab stick. Then at 24 hours of life, yeah, another one is ABO, that's for the blood group, ABO RHDCT. Then at 24 hours of life, that's when you do the lights, and then the CRP as well, the newborn metabolic screening as well. So like that lights will show a lot of things, and where there are deficiencies in the lights, there will be correction with IV fluid, you know, based on the lights results, even the bilirubin, when it's necessary, they will start phototherapy. So, and I also want to urge us, please, don't only consider yourself when you are doing antenatal. Consider a hospital that have a good NICU care in case your baby may need NICU care. Yeah, it's very important, because sometimes the distance in transportation can have adverse effects where there is no good support till the baby gets to the hospital that have good care. So before I deviated, yeah, I was on signs that the baby is premature. Yeah, we mentioned the low birth weight, the difficulty in breathing, the low temperature, because their skin is still premature. It's difficult to maintain the body temperature. Then, oh, there's this hair. If you know the Lanovo, it used to look very, like, it's so unique. It's always there on their skin. Then feeding difficulties, yeah, you know now, the swallowing is usually a little bit challenging. So there are cases of a lot of feed aspiration with premature babies. So this is one thing that we teach the mothers to pay close attention. Some of the premature babies, they will be feeding through NGT, nasogastric tube, or orogastric tube, until their swallowing reflex has fully developed, before they can now start taking oral. And even when that is done, it is done with precaution, because feed aspiration is very common. And even when the mothers are discharged, a whole lot of teaching and health education is done on this. Then the next thing is, what are risk factors for premature birth? Some of the risk factors, expecting multiples like twins, triplets, or more, age of 17 and below, or age of 35 and above, can cause prematurity, because at that age of 17, the pelvis is not so developed, the pelvic bones, and then that of the age of 35, the woman looks a bit advanced. Then family history of premature births, yeah, smoking, drinking alcohol, or use of substances while pregnant, this can trigger premature delivery also. Okay, these are the risk factors. Then being underweight before pregnancy, or you did not even gain weight during pregnancy. This can also cause premature delivery. What are the health complications of being born premature? There are a whole lot of them, but we are going to discuss this one's anemia. Yeah, not having enough healthy red blood cells. Remember, in the production of blood cells from the pluripotent stem cells, it's usually from the bone marrow. So what happens in premature babies? The bones are not even developed enough, talk less of doing what it should do. So it affects their blood levels. Transfusion is one thing that is really realistic. For those ones with low hemoglobin, immediately we are doing the transfusion when the HB is very low. And even for those of them that are bleeding, FFP, fresh frozen plasma, it's also prescribed, and it's done with immediate effect, and other medications that helps with blood clotting are also administered. So the second on complication of prematurity, apnea of prematurity, yeah, this occurs because the brain is still developing, the lungs are not completely developed, so there is that break in that mechanism of controlling, you know. Yes, so let me not go so deep here. So clinically, apnea occurs once there is a cessation of breathing for over 20 seconds and above with severe desaturation, and sometimes the babies get diagnosed. There is this change of color, like they are looking a little bit bluish or kind of black with mottling. So severe desaturation and bradycardia also, sometimes even down to 50s. So if this is observed immediately, there will be change in ventilator support, and sometimes when it is necessary, some blood investigations will be done. It could even be that the HB is low, but the confirmation will be after the investigations prescribed by the physician are carried out, and even blood gas also. Then we have bronchopulmonary dysplasia, respiratory distress syndrome, or underdeveloped lungs. Yeah, we are talking about complications of prematurity. Yeah, I mentioned earlier, even staying for long, because those ones that come out around 26 weeks or 25 weeks, some of them stay on ventilator for as long as 3 months. Yes, so there are also complications about it. I mentioned one of it, ventilator associated pneumonia, VAP. It's something that is common also, but the good thing is that for babies that God helps them to survive with good medical support, they grow over the complications over time. So the next complication is intraventricular hemorrhage or bleeding in their brains. Yeah, we have IVH, grade 1, grade 2, grade 3, like that. Then newborn jaundice, hyperbilirubinemia. Yes, so this is usually done when we check the light. We have the total bilirubin and the direct bilirubin, and there is a chart for checking this depending on the gestational age of the baby. So that is what is usually the determinant if we will start phototherapy treatment and other treatments that are related for hyperbilirubinemia, that is neonatal jaundice. So the next complication of prematurity is necrotizing enterocolitis, NEC. So the thing is, this is inflammation of the intestine. Remember, we are talking about prematurity. The organs are not fully developed. But over the years, what I've come to see in NICU practice is that when the premature baby starts feeding and then there is breast milk, it helps them a lot to prevent this necrotizing enterocolitis, because the formula on the other hand is a more difficult for their system to digest. So this necrotizing enterocolitis occurs because the digestive system is still premature. The lower GIT cannot do the function that it should, and organs that play important role in digestion, like the liver, they can't do what is expected, and all. Then the next complication is neonatal sepsis, otherwise infection. Yeah, remember hospitalization, there is what we call nosocomial infection. Hospital-acquired infection is not different for the newborns. If adults that even have immunity are still at risk, how much more for the very smallest category of human beings that don't even have fully developed organs. So it's realistic. Then patent ductus arteriosus, in the fetal circulation, we have the major organs in the heart that differentiates that this is the heart of the baby while still growing inside, because the heart is not doing the work it's meant to do. But when the babies come out, those organs, those specific features take adjustment so that they adapt to the extrauterine life. For some issues, for some reasons, for the premature babies, you see that because they weren't fully developed, this very patent ductus arteriosus, it will not help the baby to survive well with the flow. Like the heart will not be able to do that proper arterial blood flow, and pulmonary circulation and systemic circulation will have some challenges. Then retinopathy of prematurity, this is about the eyes, yeah, because the blood vessels are underdeveloped, the blood vessels of the eye, so it can cause some issues. So the next complication is the ones that show up during childhood. We have cerebral palsy, hearing and vision problems, learning disabilities, poor growth, problems with communication or social development. So now the thing is, people do ask, are there complications for the mothers? Yeah, for the mother of a premature baby, it's realistic, there is. And number one of it is anxiety. So then the next one, every mother expects to have their baby by their side, to cuddle, to suck, like it helps them psychologically, and it's so emotionally draining when they come to the NICU. If your baby is in intensive care unit, when you come, you don't even know what the outcome will be like with all the intensive care support you are seeing. It can take a toll on the parents, it can take a toll more on the mother. When your breast is gorging, the baby is not there to suck, but in reality, it helps to express and take it to the hospital. The nurses will label the baby's name, date of collection, and preserve it well for you. So now the complications now for the mother, one is anxiety, then the second one is postpartum depression, then the third one is post-traumatic stress disorder, PTSD, then problems bonding with their baby. There are some babies that will stay as long as 6 months, 6 months, 5 months. By the time they are out, they are used to not being attached to the mother. So the mother has to start afresh. It might now be taking time at that time, but my dear, you can scale through it. Yeah, it's just that it will be at a little challenging at the beginning, but now when the baby is discharged and is with you, you can now start your mother and baby relationship, and trust me, it will go well. So the next question is, do premature babies need special care? Sometimes they may need special care, but based on the assessment of your neonatologist, that is a specialist, the specialist for your baby, depending on your baby's condition, they will tell you if your baby will need special care or not. In few cases, there are sometimes that babies may need oxygen support in the home, so they will teach you about it. And then there are some that will be discharged with feeding tube, either the nasogastric tube or oral tube, depending. So that's why I'm saying generally it all depends on your baby's condition and the judgment of your neonatologist, because most of them will still like to keep the baby in the NICU to see if they can wean off any form of support to the barest minimum of what is considered safe for you to handle at home. Then management and treatment, preterm infants often need specialized medical care in NICU. This is a specific part of the hospital for babies that need extra care and medical attention. Some babies stay in the NICU for weeks or months. However, preterm infants often need help with breathing, feeding, gaining weight, and maintaining their own temperature. That's why, like in our NICU, we have the isolates, that is the incubators for extreme preterm, those ones that are less than 1 kg. The category of incubators to be used is different. Then for the ones that are like late preterm or early term, they also have a different type of incubator. This is the different categories helps them in this temperature maintenance, because once the temperature is not maintained, it will affect a lot of things. So temperature regulation is very important for the premature babies. So does preterm labor always cause preterm births? No, it's not in all cases. There are times that preterm labor stops and does not result in birth, but labor may stop on its own or with the right treatment. Then if you go into labor, your healthcare provider may recommend certain medications to stop or delay labor. If those medications don't work, other medications may help prepare the baby for birth and prevent some medical complications. Now the prognosis, the outcome. Can premature babies have a normal life? The big answer is yes. The chances of a premature baby growing up to be healthy are quite good, especially if they were born after 34 weeks of pregnancy. You can underline that. So, the earlier a baby is born, the more likely they are to have health complications that could affect them later in life. So, you see, when we were talking about the severely the micro preemies, those ones that are even born at 25 weeks or 26 weeks. We have even been admitting 23 weeks in my own NICU. So the thing now is that prematurity, it's already a complication on its own. So that's why as a mother, when you are pregnant, it's good you do the best you can to avoid it. And sometimes people do their best and things go wrong, but you have to forgive yourself, and at the same time on the supernatural aspect you pray for God's grace, because it's not really easy to deal with the complications that comes with prematurity when it shows up in a child. So we were talking about the prognosis. So the earlier a baby is born, the more likely they are to have complications that could affect them later in life. So the thing is that premature babies have chances to have a normal life. So the chances of a premature baby growing up to be healthy are quite good, especially if they were born after 34 weeks of pregnancy. So that's why there are even sometimes when there is rupture of membrane, based on the guidelines, they can say if the labor did not progress, let's manage and see till 34 weeks. There are cases like that in the obstetric care, but the rupture of membrane is 1 week for infection. So whenever you're pregnant, watch out for the signs. Anything you see that is strange, even your water is not supposed to break during pregnancy. So if such things are seen, you have to report to your obstetrician. So is being born premature a disability? The answer is no. Being born early isn't a disability. It only increases your risk for certain disabilities. Then prevention. What can you do to prevent premature delivery? Avoid tobacco, alcohol, or those harmful substances while pregnant. Eat nutritious, well-balanced foods during pregnancy. Start prenatal care in the first trimester so that your provider can identify health risks as early as possible. Discuss how to manage health conditions like diabetes and blood pressure with your health provider. Unmanaged health conditions can lead to preterm birth and other complications. Attend all your antenatal care appointments, reduce your stress level. Wait at least 18 months before you become pregnant again. Yes. So research and proven facts have shown that taking in too early can result in premature delivery because your reproductive system has not regained its function very well. So that is just a point for us to take note. When should you contact your healthcare provider about preterm labor? 1. Irregular vaginal discharge, like leaking amniotic fluid or bleeding, contractions or cramping, with or without diarrhea, ongoing pain in your lower back, pressure in your pelvis or abdomen. If your water breaks, that is if your amniotic fluid breaks. That one, sometimes it happens so unknowingly. Sometimes people are sleeping, then as you are just waking, you see that your bed is soaked. So that is not a time to waste time. Just contact your gynecologist immediately and then follow up with the instructions. So in conclusion, premature births can create serious health concerns for a baby. When an infant does not have enough time to develop in the uterus, important organs may not fully develop. However, advances in newborn care are helping many preterm infants grow into healthy, robust children. So, the best way to prevent premature birth is to attend all your antenatal appointments, manage an underlying health condition, and live a healthy lifestyle during pregnancy. Be sure to always share your full medical history with your provider so they can help best care for you during pregnancy. So, I believe that we may have learned one or two things. So, this is not just about the woman only. As a man of the family, you have roles to play. I always that healthy lifestyle is very, very deep. Healthy lifestyle during pregnancy. Stress is something that should not be indulged in any way. There should be people helping you out. If it means employing from an agency that is known to be professional, you should do for some help about chores, or if you have family members that are willing to help. Yes, so it's very sweet when you give birth to a normal baby. No. So in summary, for me, it's been a great privilege sharing this knowledge, sharing my experience, also joining my voice with the World Health Organization, that we should make our voice loud regarding this awareness for premature babies, for prematurity as a whole. So I believe that one or two things here have been interesting, have been something that can be helpful. So don't get it wrong. When it comes to the NICU care, it's not only for the premature babies, but a lot of times about 80% of the admissions so far in my past 7 years of practice has been prematurity. So I believe that we will do our best, what we can do on our own side, to prevent it, to reduce the prevalence as much as possible, you know. So thank you so much for staying tuned. Thank you so much for watching with me. And for the first time I'm holding this mic like this, I realized that this time around the sound wasn't good when I pinned it on my clothing, so I decided to just have it handy like this, and that's how we have made we have used it for this production. But over time you will get to see how to go about it to be better than this. So I want to tell you thank you so much for watching through, for liking, for sharing to others to also create awareness. I truly appreciate. Okay. See you in our next video. Bye.